All right. So now we're going to be talking about the extremes of intelligence. We're going to start off talking about high intelligence, and then we're going to talk about low intelligence, and then kind of how intelligence has changed over time. So when we talk about extremes of intelligence and we talk about the higher end of intelligence, we're talking about giftedness and genius. So people who are intellectually gifted individuals, they make up 1 to 3% of the population. They score 2 or more standard deviations above the mean, meaning that they score 130 or higher on a standardized IQ test. Genius is a special term that combines unusually high intelligence on an IQ test with creativity and achievement. Just because a person has extremely high IQ does not mean that they are a genius. On the other hand, someone probably could be considered genius because it's not really like a technical term. They could be considered genius because of their creativity and impressive works, even if they don't necessarily have a high IQ score. Typically, though, those things go together. It's high intelligence with creativity and some sort of achievement. Having a high IQ does provide some significant advantages for people. Back in the 1920s, in 1921, there was this man named Lewis Terman, and he decided that he wanted to study children in California who had an extremely high IQ. Of the original participants, they had an average IQ of 150. So they had very high IQs. Again, 130 and higher is considered to be extremely intelligent. So these kids were even further above that. He followed them throughout their lives, and what he saw with his research was that throughout adulthood, these kids who had this gifted IQ, they not only maintained their high IQ throughout their life, but they also enjoyed better physical health, emotional stability, occupational attainment, and social satisfaction throughout their adult lives. It was a really impactful study. It was the first of its kind, but I do want to give the caveat of the fact that Lewis Terman was not the most objective researcher. He oftentimes played a direct role in the success of his subjects. So he actually would write letters of recommendation and help them get jobs, help them get into good colleges. He also would give them a hard time if they weren't living up to their potential in his eyes. So, like, one of his participants, I think, became a mailman or something, and he was giving him a hard time because he had all this potential because he was so extremely gifted, and why was he wasting it? But obviously today, research like that would not be conducted in that manner, but it did give us some really interesting clues into how high intelligence plays a role in one's life throughout their years into adulthood. And some of these people, I believe, are still being monitored today, although they'd be close to 100 years old if they are still alive. The funny thing is, so his name was Lewis Terman. They called themselves the Termites. So if you ever hear about that, it's kind of fun. Again, high IQ does not capture what we mean by genius. So gifted participants in longitudinal studies that I just explained did not necessarily produce genius work. But not all remarkable thinkers have this extremely high IQ. Richard Feynman, the Nobel laureate in physics, you probably have heard of him if you watch like Big Bang Theory or if you're interested in physics in general. He only has an IQ of 124, and that kind of made him upset when he found that out. So it's kind of interesting. Children who do have unusually high IQ scores do benefit from educational opportunities that are tailored to their abilities. This is where we get into gifted testing and gifted education programs in public schools. In public schools, it's hard for districts and schools and teachers to provide optimum learning for children who do have significantly high IQs. According to the Department of Education, children who have an IQ score of 140 or above typically know half the grade's curriculum, half the material before the school year even begins, and those who have IQs of 170 or above pretty much know everything. So because these kids are coming into school and they already know everything, you can imagine what happens. They get bored, they start acting out, they're not studying. It encourages poor learning habits, and then when later on, when they're challenged, oftentimes they struggle, and if they're not getting perfect scores easily, they don't know how to handle that. Maybe that sounds familiar to some of you guys. If you've never had to struggle to get a good grade or have to study hard or work hard to write a paper or study or practice in math, when you're having to face that for the first time, it can be really daunting, and developing those skills to study and to work hard and to persevere amidst failure is something that kids really struggle with, adolescents really struggle with, and I think a lot of you guys struggle with. So I'd like to hear your thoughts about that in the discussion board, if we have that going on, or in class. So a lot of schools will try to target education to the individual's intellectual strengths and weaknesses. Even if you're gifted overall, sometimes it doesn't necessarily come out when in all areas. So you might be gifted in math, but then writing and reading become really difficult, or vice versa. It's not usually a person who's gifted across the board in all different areas. Now, another problem with giftedness education is that, the teachers who teach gifted classes typically have higher educations, they're better trained, they have some sort of gifted certification, and so they're being targeted on this small group of students who have this intellectual advantage. But then that leaves the students who maybe need extra help, could use extra enrichment, without it, because the school can only provide so many teachers with our current education system's finances. It's hard to balance, providing gifted education as well as education for students who are lower achieving and trying to get them up to average levels. So oftentimes giftedness programs can pull resources, or the argument is that giftedness resources pull from the resource pool that could be used to benefit everyone. Also, who gets selected for gifted programs does seem to have some like parent politics involved. So parents who know about these programs or will push their children to be tested for these programs will get into gifted programs, but parents who don't know that these are opportunities or don't encourage teachers to test their child, or insist that their child gets tested for giftedness, may not, their children may not actually get into that. Now, another really interesting study happened, I think it was back in like the 50s or 60s. What they did is they had a group of like first graders or something. It was a class of first graders, and before the school year started, they told the teacher, hey, these 10 students in your class, they have extremely high IQs. These other 10, they have normal IQs, but these 10 have high IQs. And they had tested the kids' IQs beforehand. They had the teacher go through the school year, and then they tested the kids at the end again to see how their IQ scores may have changed over the school year. The interesting thing is that the kids were all average students. They just told the teachers that half of them were of high IQ. The kids who had been labeled as high IQ or gifted students had increased their IQ significantly more throughout the school year than the kids who had been labeled average. The idea behind that is that by telling teachers that a student is gifted, it makes the teacher push them more. They have higher expectations of their work. They encourage them to kind of give more detailed answers, and that pushes them intellectually. So that does increase their IQs, even if they start off at the same spot. So do gifted programs actually just help gifted kids, or does it take, maybe kids who are average or above average and make them into gifted kids through additional enrichment? And that's a big topic of discussion. And I'm sure a lot of you guys have had your positive and negative experiences with gifted programs throughout your K through whatever education that you guys have done already. I want to hear your thoughts on this. On the other extreme end of intelligence is what we call intellectual disability. So this is a person who has an IQ score of 70 or below and a significant impairment of adaptive behavior. So individuals who have an IQ of 70 or below oftentimes struggle to manage their own affairs. That can mean their personal hygiene. It could be cooking and cleaning for themselves, handling their finances, getting a job, going through school. These things are extremely difficult, if not impossible, for these individuals. In this picture here, this is relating to a video that I have linked below in the playlist on Williams syndrome. You guys probably all know about autism, right? It's usually high intelligence with low verbal IQ, low social IQ, but Williams syndrome is kind of like the symptomatic opposite of it. They're not in no way related to one another, but with people with Williams syndrome, they have low IQs, but they're really socially and musically advanced. You can see these people here singing and playing instruments. people with Williams syndrome are super sociable. They love personal contact. They love to hug. They love animals. They love to just chit chat with strangers, anyone. But on the flip side, they have this low intellectual issue, and it's interesting to see how that plays out. So I have a video for you guys linked below. When it comes to intellectual disability, it can be caused from a variety of different things. So we do see mild intellectual disability that can be associated with homes that are intellectually poor. So maybe parents who have low IQ, they're not providing a highly enriched environment for their kids. They're not reading to them. They're not talking to them. Or if they are talking to them, it's a very low level. They're kind of just leaving them kind of on their own. They don't have a lot of toys for them to play with, not a lot of ways to challenge them mentally. They could be nutritionally deficient. So if a child is not getting enough nutrition, they may become intellectually stunted because they don't have the raw materials to build their brains. And also intellectual or emotionally impoverished. So if a child is not getting the proper contact, care, and comfort and love, they may not actually be able to develop all of their intelligence in a normal way. Intellectual disability can also be caused by an organic disability. This is could be caused by a birth injury, such as lack of oxygen, fetal damage. We've talked about prenatal exposure to teratogens. Again, those are chemicals or substances that cause birth defects. So alcohol or illicit drugs, could be an infection, or exposure to a toxin such as lead or mercury. Those can all cause damage to the brain and nervous system prenatally or in early childhood. We've talked about, lead and the Flint water crisis and how all those kids were exposed to high levels of lead in childhood, which has led to emotional and intellectual difficulties. Metabolic disorders, we're going to talk about one of those in a couple of slides. Also genetic disorders, so having missing or extra genes, defective genes. So Williams syndrome, as you hopefully saw, they have extra genes, or it's a deletion, of just a couple of genes in one of their chromosomes. Or we're going to talk about what's known as Down syndrome or trisomy 21. They have a third chromosome, or a third 21st chromosome, and that leads to Down syndrome, also known as trisomy 21. And then Savant syndrome, that's a possession of, this is an interesting condition. This is the possession of exceptional mental ability in one or more very narrow areas. So typically these people have really low IQ in general. They would not be able to manage their own affairs. They would not be able to adapt to their surroundings. But they have this extreme, just essentially gift in one specific area. They could be do mental arithmetic, could be calendar calculation, art, music, but in general, again, they have low intelligence, but they have one really, really impressive area. So I'm going to link a couple of YouTube videos as well in the playlist for you to check out relating to that. So Down syndrome is a genetic disorder caused by the presence of an extra chromosome, and this results in intellectual disability, and it happens at a rate of approximately 1 in 800 babies. It's an extra 21st chromosome. Again, it's called trisomy 21. That's the technical name for it, but it's better known as Down syndrome. It's more common in women who have babies later in life, so they call it advanced maternal age, so after the age of 35. Now, there's a wide range in how severe Down syndrome can be. They have physical as well as intellectual issues, so if you can look at someone and you can usually tell if they have Down syndrome. Usually they have a rounder, flatter face, they're a little bit shorter in stature. They have some health complications relating to that. But some people, it's more mild, and, there have been people who have Down syndrome who've gone on to college and been successful and can live independently, but oftentimes they do need additional care throughout their life. There's also what's called Fragile X syndrome. This is a genetic form of intellectual disability caused by a defect in the X chromosome. Because again, boys only have one X chromosome, they're XY, girls have two. You see a mild impairment as their children, but it becomes more severe with age. And then there's this phenylketonuria, I can never say it, also better known as PKU. This is a genetic disease that allows this phenylpyruvic acid, to accumulate in the body. It's present in a lot of our food, so they have to eat a special diet. if they have this condition, you see lower levels of dopamine. It can cause severe intellectual disability. But if this this acid is removed from their diet, they're fine. It's one of the things that they test for with babies right at birth. They take a small blood sample when babies are born, and they test them for this. And if they have it, they can stop them from eating most normal foods. They have to eat a very limited diet or buy specially processed food, so it has this acid removed, and then they will be okay. If they start eating normal food, the intellectual disability will occur. It'll kind of come on, but then if they go back on the special diet, most of that will go away. Now, obviously, if they're on the incorrect diet for 10 years, it's not going to have as much of an effect versus a couple of weeks or a couple of months on an incorrect diet. So that's a really interesting condition. We also have what's called microcephaly. This is a disorder in which the head and the brain are abnormally small, and the skull fails to grow, so the brain has no space. These children are typically institutionalized, but they are affectionate and they are well behaved. This really hit the news a lot when the Zika virus became major headline news, because it was caught Zika virus when a pregnant woman is infected with it, especially in the first trimester, those first few weeks of pregnancy. Their babies are born with microcephaly, so their brains are really small, and the cerebral spinal fluid, trying to remember the name, the structures in the middle, you can see in this lower picture here too, those are kind of abnormally large. They don't have much cortex. On the other side is what's called hydrocephaly. This is a buildup of the cerebral spinal fluid that fills up the brain's cavities. They can usually tell this is occurring via ultrasound, so they can scan the fetus and see that the head is abnormally large and that these brain cavities are essentially getting puffed up with the brain fluid. Doctors can actually go in and implant a drain during prenatal development. Essentially, like, they do a partial C-section, they open the woman up, they take the baby out, they can do this surgery, they put a shunt in, so they drain the fluid from the brain down at the abdominal cavity, and it minimizes the damage. They typically will have lower IQ, but it's not usually a severe impairment. So modern medicine has been able to prevent the worst consequences of this. And about 10,000 babies are born each year in the U.S. and Canada with this condition. Now, we're talking about the biological influence of intelligence. So obviously our brain's structure and activities play a major role in how our brains function and then our intelligence as well. So brain structures that are, well myelinated, we've talked about back in chapter 2, are really important. But things like concussions can damage the brain, alcohol intoxication can damage the brain, and lower intelligence. People always ask about the heritability of intelligence. So you can see here on this chart, if we look at this dark purple on the left, or this dark blue color, this is supposed to show identical twins who are reared together. They have a heritability of about 0.85. So that's pretty high heritability, but there's still about 15% of their intelligence heritability that is unaccounted for when it comes to genetics. If we see identical twins reared apart, we see that the environment seems to play a larger role. Non-identical twins reared together is very similar, but if we just look at, siblings who are reared together, so like you and your sibling at home, about 45%. So there is a heritability component, but the problem with this type of twin study stuff, so there seems to be some heritability between, parent to child. So if you have really smart parents, they should pass on their smarts to you. But it's not just genetics that they're passing on to you. They're passing on the environment. So parents who are intelligent are going to provide usually better income to their families, better healthcare, better nutrition, more enrichment for their child. They go to better schools. They live in better neighborhoods. They live in healthier environments. And all these things can increase a child's IQ. And of course, the opposite things can decrease a child's IQ. And identical twins reared together versus rearing apart, identical twins are going to have a very similar environment at home. But even then, if you know anything about twins, oftentimes one is born a little bit larger than the other because of just differences in blood flow during prenatal development. They're not going to get equal space in the womb. One usually kind of outcompetes the other one to a certain extent. So that can play a role as well. So take twin studies with a grain of salt. I think you should look into that. There is some interesting podcasts about that on Canvas if you're interested. But so there is a heritability component, but that is not the end-all be-all. Now, the environment and its influences on intelligence, kind of what we've just talked about. There is this interesting phenomenon called the Flynn effect. We have seen an increase in the average IQ in recent decades across the world. So what was a score of 100 in the 1950s and 1960s, it would now be about a 95 on an IQ test. Now, it doesn't mean that our tests have gotten easier. It means we've actually had to make them a smidge harder because IQs are raising. We keep having to re-standardize the test to 100 every few years. We, as in like psychologists and psychometric testers. They think that IQ has increased for a variety of different things. We think in particular it has to do with improvements in health around the world. If we look at a country's freedom status and freedom from infectious diseases, we see increases in IQ scores. So as people's bodies don't have to fight in childhood for basic survival, they're not getting malaria and measles and diphtheria and dysentery over and over again. If they're healthy as a child, they're able to be healthier adults and have better brains. If your body is busy fighting off an infection every couple of months, it doesn't have as much energy to devote to the brain. Again, our bodies are economy systems, and it can only do so much with limited resources. So having good health is really important for intellect long term. So we see as nations become wealthier and more capable of battling diseases, their IQs increase. We can look at North and South Korea, that's pretty close to the same genetic population, but South Korea seems to have higher IQ scores than North Korea. It's hard to test, though, in North Korea for obvious reasons. But they don't have the same health care, they don't have the same nutrition in North Korea as they have had in the last 60 years in South Korea. So it's a very interesting effect. There are positive things that can increase IQ. We've talked about them. It could be education, nutrition, health, enrichment as a child, people talking to you. This actually came up in like one of the early presidential debates. Some fact about how many words a day wealthy parents speak to their kids versus poor parents speak to their kids. And now it wasn't a well-framed argument in the point of the debate, but what the point of the politician was trying to make, that the more you talk to a child, the more enriched their environment is, and the more we can support parents to have this time and encourage them to communicate with their children, the better off their children are going to be. Negative influences can be disease, poor nutrition, poor education, abuse, of course, poor contact and affection. All these different things can decrease or stunt a person's intellectual abilities. And we do see differences based off of socioeconomic status, but it has nothing to do with poor populations being dumber or having lower intelligence. Of course not. It has to do with the environment in which these kids are being raised. If your parents are working 2 jobs and barely making ends meet, you're not going to have the same nutrition as a wealthier person. You're not going to have the same health care and disease-free childhood. You're not going to have the same games and toys and chances to go to the farm, to the zoo, to museums, to aquariums, and things like that. That those enrichment things that we do for fun are also really intellectually stimulating. And so we see these differences in IQ, not because poor people are stupid, but because the environment that they're raised in makes it harder for intellectual development to reach its peak. So if we can provide early educational intervention, like you see here in the picture on the left, where kids are in preschool, that is wildly improved outcomes for kids because they're getting this intellectual stimulation. So things like programs like Head Start, free preschool, free reduced preschool, free and reduced lunch, breakfast, all these things really do increase people's intelligence and population's intelligence over time. So these are really important things that our country is trying to invest in. All right, so that's the end of chapter 9. I hope you guys enjoyed it, and I look forward to hearing your thoughts on what we covered.